Good day. My name is Michael Mansour, and I am a physical therapist at the St. Cloud VA. Today I'm going to talk about exercise and its importance for heart health. Exercise is very important for heart health. Your heart is a muscle, and like all muscles, exercise helps maintain peak health. Inactivity is one of the major causes of heart disease. Exercise has been shown to improve heart health and may even help reverse some heart disease risk factors. Exercise improves your good cholesterol or your high-density cholesterol. Excess cholesterol accumulates on the inner linings of your arteries. As this continues to grow, blood flow is blocked and clots form, which can break away and cause strokes and heart attacks, among other major medical problems. Triglycerides are a fat found in blood. Exercise helps lower this. High blood pressure is directly correlated with high incidence of heart disease and strokes. This also tends to rise as we get older. When arteries are clogged, it increases blood pressure as the heart has to work harder to push blood through. This puts more strain on the heart as the blood return is not as efficient as it would be with healthy blood vessels. Other benefits of exercise include a lower risk of diabetes, a hedge against colon cancer, stronger bones, weight loss, and a longer life. So what does exercise entail? When we discuss exercise with patients, we talk about the frequency, intensity, time, and type of activity, or FIT. Before beginning an exercise program, it is important to check with your doctor to make sure you are able to tolerate exercise. Infections, unstable or undiagnosed heart conditions, or recent heart attacks will need close monitoring prior to starting an exercise program. An exercise program consists of a warm-up, a workout, and a cool-down. It is important to warm up prior to an exercise program. Starting gradually allows your blood vessels to increase in size, ensuring your muscles are well supplied with oxygen. It also allows your heart rate to slowly rise, which minimizes stress to your heart. The cooling down phase is important too, because after exercise, your heart is still beating faster than normal. Your body temperature is higher and blood vessels are dilated. If you stop too fast, you could get dizzy and pass out or feel sick. I will now talk about frequency, or how many days a week we need to exercise. Everyone should try to be active 5 or more days a week. Start slowly and gradually increase activity. If you are a beginner, start with 2 to 3 days of aerobic activity. This is an activity that increases your heart rate. Gradually increase to 5 days a week. This chart shows different phases of intensity and the benefit or effect of each activity. Everyone, including beginners, always warm up and cool down. Be active at a moderate intensity, like a brisk walk. Be active at a rate that allows you to talk. Slow down if you have trouble breathing or can't catch your breath. Stretching is good to do after exercise, but should never be painful, just a gentle pull. When we are in moderate intensity exercise, we breathe a little harder and may sweat slightly. It is an activity you should be able to do for 45 minutes. Examples would include yard work, brisk walking, or slow cycling. During vigorous exercise, you are breathing harder, your heart is beating faster, and you are sweating. Examples include running, swimming, and racket sports. There are 2 easy ways to measure how hard you are working. The talk test. In moderate intensity, you should be able to carry on a conversation comfortably. If this is difficult, you are at a vigorous intensity. The Borg, or perceived exertion scale, helps grade how hard the activity is. It goes from 6, or very light exercise, to 20, which is maximum effort, which is difficult to do for longer periods of time. How long do I need to exercise? Try to stay active for at least 10 minutes without stopping. Remember, something is always better than nothing. Aim for 30 to 60 minutes of activity throughout the day. If you can do 30 minutes, you can increase the time or increase the intensity of the activity. The American Heart Association recommends an average of 40 minutes of moderate to vigorous activity 3 to 4 times a week to lower blood pressure and cholesterol. There are 3 main types of exercise: aerobic exercise, strength training, and stretching. Aerobic exercise increases your endurance, improves heart rate and lung efficiency, and is a good pain reliever because it helps release endorphins, or the body's natural painkillers. Strength training is important for pain relief, strong bones, and increased power, which translates into more usable energy. Strength training is good for weight loss as it increases your metabolism throughout the day and even when you sleep. Stretching helps maintain good range of motion, which is good for pain control, improved balance, as well as muscle coordination. It also relieves muscle tension and improves circulation. For more information on exercise and heart health, visit move.va.gov.